this point. Okay, so welcome everyone. This is Kim Watson, Founding Director of Project Joy based in Lancaster, California. We are so pleased that you could take time out of your busy day and busy schedules to join us for what we feel is a really important conversation. And this time, our time together is short. It's 1 hour and we have quite a bit planned. But the key thing is we really want to have time to engage, for all of us to engage with each other and have conversation around the youth COVID-19 rapid needs assessment survey results that our company was really fortunate to do with the assistance of LensCo. LensCo is a research company based in Los Angeles. They handled all of the technical aspects, all of the methodology, all of that good stuff that's needed for a really successful survey. We also would like to thank our partners. There were several agency partners involved in this project. First off, we'll start with our Youth Artificial Intelligence cohort number 1. This was a peer-to-peer based survey, and so our youth cohort members were at the front steering the ship with us here at Project Joy. But in addition to that, the agency partners that assisted by providing youth that we could survey was AV Youth Build, Youth with a Purpose. I'm drawing a blank, you guys, help me out.
Yes, it's the next slide.
There it is. We have AV Youth Build, Youth with a Purpose, Desert Sands Charter High School, which is part of Learn for Life, and Penny Lane Tay Drop-In Center. So we thank you so much for partnering with us on this project. And so with that, I'll just go ahead and give a brief introduction of Project Joy for those who may not be familiar with us or our services. Like I said, we're a 501c3 based in Lancaster, founded in 2014. We operate under 3 E's. Our goal is to empower, to educate, and to encourage. And we are doing that for families and youth in our community. And our mission is to spread joy. Joy is also an acronym for jobs and opportunities for youth. We operate as a work-based learning site in the community. And we have a vision to break the cycle of generational poverty, through the power of opportunity. So it's all about providing youth with opportunity and access. And we have several programs currently. Our programs basically impact, one second, guys. We impact families and youth who are homeless, low income, teen parents, foster youth, domestic violence survivors, and those who may have justice system involvement. A major focus for us is linking those that we serve to community support and services, such as many of what you offer that are attending this info session today. We also offer career mentoring and employment assistance. Next slide, please. A few of our programs you'll see here listed. And that photo, I'll just point out, this is a photo of our team. Our iFoster team members are in this photo, as well as Project Joy team at the time, with our wonderful partners at Lockheed Martin. That's a really good showing of support from Lockheed Martin on that day, and that was our youth summer program. It was called Lunch with Lockheed, and we spent the day at the Children's Center of the AV as our host site. A few of our events are on the left side of your screen. We have our pop-up baby boutique, which is funded by the Village Fund as part of the AV AIM initiative, which is Black maternal health. We're working for birthing rights and justice. We also have been very heavily involved in COVID-19 safety campaigns, resources as far as Let's Feed LA and so forth. And like I mentioned, I foster Te America AAGC host site for several years. And we also have provided Cal EITC outreach, which is a proven anti-poverty strategy. And next slide, please. So at this point, I just want to give you guys a brief overview of our Youth Artificial Intelligence Training Program. And this is where the survey stems from. So just to give you a little bit of perspective, our youth artificial or AI training program. It's funded by the Department of Mental Health. It's under the Transforming LA, which is an innovative pilot, and we're so grateful to be a part of it for this year, 2021. Our youth are ages 16 to 25. During this program, which is 6 weeks, and we've been operating it virtually due to the pandemic, they do receive a stipend for participating in this learning program. We provide a laptop when necessary, and we also provide, basically it's a curriculum on artificial intelligence basics, just foundational basic knowledge of artificial intelligence. But from that base knowledge, they have been able to put together pitch projects that have been mind-blowing to many industry professionals, including some of the coaches and contacts that we have at NASA. So it's just been incredible. If you visit our website, which is projectjoyusa.com, we are posting our first 2 cohorts AI pitch sessions on our website. So you will have access to those, and you can go ahead and see the incredible thought processes and the imagination, just the innovation and creativity that our youth have. It's really astounding. And also in the AI program, they are certified in the top 10 soft skills that employers value the most, and that is research-based. And so that is what our soft skills curriculum is based on. And we incorporate the soft skills with everything we do. So they actually practice those soft skills throughout the 6 weeks, including the pitch project, which is part of their culminating project. The program is led by Derek Gordon. He is our youth facilitator as well as our program coordinator here at Project Joy, and he does a wonderful job. He has a background in film and media, so he's very creative, and he knows how to really get our youth engaged and make it an interactive learning process. And also, I just wanted to mention that we incorporate mental health practices, resources, and support in the program. We have a DMH trainer that comes every cohort and provides a really in-depth and thorough training on mental health for our youth members, which has gone over very well. And we also have career mentors, and that's through our guest speaking program. So we're always looking for guest speakers from various industries and backgrounds to engage with our youth through the AI program, and just sharing your experiences in the world of work, how you balance your mental health, with your profession, and career tips in general. And the next slide. And at this point, I will go ahead and pass the mic to Jalissa.
Thank you so much, Kim, for that amazing rundown. Like, things are moving. So thank you, everyone, and good morning, and welcome to our rapid needs survey assessment. And we'll just be going over the information that we gathered. So what we are doing, the needs assessment, we just wanted to assess the urgent needs and immediate impact of young people experiencing homelessness or housing instability in the Antelope Valley due to COVID-19. We surveyed in total 73 responses, ages 16 to 25, from the following agency partners: Project Joy, AV Youth Build, Learn for Life, Desert Sands Charter School, Penny Lane Tay Center, and Youth with a Purpose. And we thank you, thank you, thank you for your contribution. Understanding the impact of COVID-19 on the unhoused population is necessary to perform allocation of institutional and organizational resources, policy drafts, leveraging community resources, amongst other things. The assessment also provides a platform for community voices to be heard. That's why these sessions are so imperative, because we have to vocalize our needs. So, the definition of homelessness. Homelessness is currently living outside or in place not intended for human habilitation. Living within the homelessness system, i.e., shelters, transitional living, and those at risk are those who might be sheltered tonight, but it is not stable. It is also anyone who is receiving services from an agency partner automatically qualifies as well. And the definition for housing instability is encompassing a number of challenges such as having trouble paying rent, overcrowding, moving frequently, staying with relatives, or spending the bulk of household income on housing. So, what the data shows, the majority of the youth surveyed are knowledgeable of the dangers and risk of COVID-19. The surveyed youth also are familiar with proper prevention and ways of reducing likelihood of contracting the COVID-19 virus. Masks, social distancing, and vaccines were all various ways the majority of the surveyed youth agreed are necessary to protect their health. The majority were also tested regularly and expressed interest in receiving the vaccine. However, even with the knowledge of COVID-19 information and access to resources, the virus has still had a great negative impact on our youth's lives, particularly their employment, housing situation, education, and mental health. So, with that being said, I'm going to pass it to Derek and he will go into the statistics.
Absolutely. And just to give you guys a quick overview, also, the entire survey in completion is around 58 pages long, but we were able to condense it into this into a brief overview. But if you want to see the entire survey, be sure to check out our website shortly, and we'll have the entire survey listed. All right, cool. Let's jump into it. All right, cool. So nearly half of the youth's employment status has been negatively affected by COVID-19. So the question is, did you lose income or have reduced hours due to the coronavirus pandemic? And nearly 50% of the applicants said yes. All right, next slide. 1/4 of the youth have experienced homelessness for the first time due to COVID-19. Homelessness caused more stress. So over 1/4 of the youth have slept in their car as a result of homelessness. Um, as you could see with the facts and figures, many of these individuals, they also had contact with police while sleeping in their vehicles. The youth's top concerns are housing, employment, and health/mental health. Um, So with the question, it says, what are you most concerned about COVID-19 having an impact on? And the top three things were housing, employment, family health, and mental health. But one interesting aspect is if you see at the bottom, physical health is least. So this kind of almost like displays that that the youth are currently in a survival mode. All right, the majority of youth are stressed due to the COVID-19 crisis. Um, yeah, over 30% strongly agree that just hearing about COVID-19 is just adding a lot of stress into their lives. Over half of the youth feel that they needed mental health treatment recently, but did not get it. And I'll repeat that again. It says over half of the youth feel they needed mental health treatment recently, but did not get it. Um, in the past 3 months, was there ever a time when you needed mental health treatment or counseling for yourself, but did not get it? And over half the youth said yes. So that's definitely an alarming figure. And we're trying to figure out what is the disconnect here. Over 1/4 of the youth stopped pursuing education due to COVID-19. Work experience and job readiness, top services individuals would like to have more access to, along with library and food and meal services. All right, the majority of the survey participants listed mental health, job financial security, and housing as a challenge leading into the future due to COVID-19. In addition, below are results from their greatest concerns. So as you see, topping the list is housing, employment, again, their family's health and their mental health. So overall, a wish list of the survey participants includes mental health programs, included free Zoom therapy, housing services, and food programs. And there are other different items that they did suggest that they would like, but overall, this is just kind of like the majority. There was a lot of mental health services that they were overall requesting. So the feedback from the survey was overwhelmingly positive. Many individuals expressed gratitude for having their voices heard and suggested more surveys in the future. And when we asked them about the $20 payment, because each applicant got paid $20 for taking the survey. So we asked them, how is this $20 going to be spent? And over half the youth reported using the $20 for basic needs. All right, so at this point, before we jump into the open discussion, I'd like to invite Robin and Laura from Lensco to just give an overview of how you came about this survey and any comparisons, because this survey was only done with AV youth, but they have done similar surveys in the past with different youth from LA County.
Yeah, hi, good morning, everyone. Thank you, Derek, for the overview. So yeah, like mentioned at the beginning of the presentation, at Lensco, we did a rapid needs assessment with the Los Angeles Coalition to End Youth Homelessness. And we launched that survey on May 4th of 2020. So it was really coming out of understanding that this was happening and thinking through the impact of wanting to be able to see what is being impacted for young people in LA County. So we were really excited when Project Joy asked us that they wanted to do one in the AV, because when we launched it in May 2020, we did not have someone from AV in that sample. So with that in mind, we kept a lot of the questions similar in the survey that was done in 2020 to the one that we did with Project Joy. And we launched the Project Joy survey April 1st, 2021. So I'll go ahead and leave a link here for the survey report that was done with the Los Angeles Coalition to End Youth Homelessness, so that you all can explore that, as well as having the report, as Derek mentioned, on the Project Joy website. So I'll just go ahead and list some similarities that I saw. So ones that we saw between the two assessments were the number of people saying that their living situation had changed as a result of COVID. And we had a number of folks say that this was their first time experiencing unstable housing or homelessness in their lifetime, which I know for folks who are in this area, understanding like the impact that COVID has had, it's not surprising, but it's also, staggering to just hear it and the immediate impact that it had when we looked at it in May 2020 and how that's been consistent until earlier this year. We saw in the 2020 and in the 2021 survey that there's a high knowledge of COVID-19, but trust and ability to implement strategies varied across being able to do those things to help prevent COVID-19. Another thing that we noticed was that the impact that COVID has had on young people in terms of economic impact, which I know that was highlighted here by what Derek had shared, and that employment has stayed a high concern along with housing, family health, and paying bills. When we asked young people about programs and services they wanted to access in the youth service system, and that they couldn't access them, the ones that they listed were education, employment, housing services, and mental health related services, which I know that Derek just highlighted, folks identifying that they wanted to access that service, but were unable to. When asking for other resources in the community that they wanted to access, a similarity that we saw in early 2020 and one that we saw for 2021 was folks wanting to access libraries, wanting to access food or meal services, and then also identifying wanting to be able to go to parks and access public restrooms. We saw, as I know many of us are aware of, that COVID had a large impact on employment, but then also financial responsibilities. And we saw that both in 2020 and in 2021. And some of the areas of new financial burden being similar. And I know that one of the recurring ones was being able to pay a phone bill. something that I know that Derek just mentioned, but that has stayed the same across the survey that we did with the Los Angeles Coalition to End Youth Homelessness and the one with Project Joy was just the feeling of stress from hearing about the COVID-19 crisis. And that folks are saying that by hearing it, that they feel stressed, that they strongly agree with that, or that they somewhat agree. And that's over 50% of the young people said that. And the last thing that I wanted to share is just re-emphasizing that asking young people that have participated in the survey, many of them viewed it as a way for them to use their voice and as a way to help others with their feedback for what they're kind of going through right now and the services that they wanted to access. So yeah, I just wanted to thank Project Joy again for partnering with us. And please explore the report that we did with the Los Angeles Coalition to End Youth Homelessness. And I'm excited for you all to also be able to explore the full report that Project Joy will be putting up on their website. Thank you.
Definitely. Thank you for that, Laura. And yes, as you can see that there are so many different, so many similarities among our youth and what they're experiencing right now. So what we're going to do next is we're going to separate everyone into breakout rooms, and we just want you to engage and discuss all the information that you just heard, and we're going to invite you back to have an open discussion and kind of share your thoughts and different yeah, we just want to hear your voices overall. So at this moment, Jalissa, will you be able to place everyone into breakout rooms?
Yes, I got you, Derek. And also, if in your group, if one person can volunteer themselves to, when you come back to the main group, just be able to deliver what you guys spoke about and some of the highlights on what was said. We greatly appreciate it. So I'll get the breakout rooms now. And also we'll post the questions in the chat as well. You'll have them. Hi, good morning, everyone. So this is our breakout room. And if you're unable to talk, I think you can kind of like put it in the chat. But the first question we posed was, what are some of your initial thoughts after hearing this information? Can you guys hear me? Hello?
Okay, Derek, I think everyone should be back in.
All right. I I think everyone's joining us now. 12 participants. Let's see. All right, they're coming in. All right, great. 18. I think for the most part we're all back. And I'll start it off. Jalissa, how many breakout rooms were there in total?
There were 6 in
All
total.
right, cool. And I'll start it off because I was in breakout room 6, and it's great that we actually have one of our youth from cohort 1, Aleda Bell, that was actually she was actually one of the youth that did the survey and surveyed her other peers. And I want her to start it off and share her insight and her experiences and her response from the results also. Just because she's a youth and her insight is just really essential. So Aleda, can you introduce yourself and just share your response from the survey?
Hi everyone, and I'm from the first UI cohort, and I helped with the surveys. Um, well, my response to the whole survey is that we all know that COVID-19 has affected many people, mentally, and perception of why youth are experiencing this is, well, because of the stress of the virus in its entirety, the deaths, and at the time we were literally going through historical events, with the elections and the protests, and with all the stress of that, as well as the stress of having to find housing and food and all this other stuff, that's where a lot of us kind of went into survival mode. And when we go into survival mode, you can't really focus on your mental or physical health. And I believe us as humans, we're social creatures, and that's why parks and libraries, such as libraries, things like that, was so high. And when we become isolated, it's a can become a lot onto all of us, especially the youth and everything like that. And when it comes to mental health awareness, Jose kind of helped me out with this, but a good way to try to help with that is by destigmatizing mental health, because I do believe that it's kind of a social and a cultural thing that can help us if we take more of a community-based approach to it. So if we, like, I guess, kind of connect to you through social media, educating and stuff like that, just try to bridge that connection. And I also believe that it would help a lot if government would also help us have easier access, because to mental health resources, because recently my brother actually sustained an injury, and it was actually like an emergency, but he didn't go because he couldn't afford the health care, and he was afraid that he would be charged thousands of dollars for it, but the condition just kept on getting worse and worse. So I believe mental health works that exact same way, is that if we had more resources from government and everything like that, that would help a lot. And so my experience with helping everyone, surveying everyone, um it felt like everyone was kind of focused on the now, especially like when we go into the subject of education and everything like that. I think a lot of people aren't looking forward to education, is because, like, they are in that survival mode, and I have to survive now instead of thinking about my future and everything like that. So yeah, that's my interpretation of everything. Thank you.
Great, thanks. Thank you very much for sharing that with us, Aleda. And in my breakout room, we also had Jose, and I want you to jump in and also share your experiences, Jose.
Yeah, definitely. Thanks for having us, y'all. This is super insightful to learn, and having someone like Aleda who actually did the work is really a great insight into the whole program. But yeah, I think in our conversations, we touched a lot on the mental health aspect, on the sort of effects of COVID that are not new but are being heightened by COVID, and so we see that generational trauma, that there's a history of oppression that's resulted in generational trauma, and that COVID is really amplifying that. It's really making it visible. And we have such a great opportunity, particularly like in the work that we're doing right now with COVID vaccinations, to highlight and to offer other health services beyond COVID vaccinations. And so I think wellness is a very critical component of that, and something that in like my own community is not accessible to people and sort of has that stigma. One of the ideas that I floated up as having or being useful to destigmatizing mental health would be engagement in churches. Like I know I've had friends who had serious mental health issues and were able to get family therapy at the behest of their churches. And so I think like a strategy to destigmatize that could be engaging with churches and having the churches value that and communicate that out to partners. I also realized I didn't introduce myself. My name is Jose Mata. I work with the Department of Health Services, and I'm representing our education and engagement team along with some of our vaccination team. So we did have some data that we wanted to share with y'all. At any point in time, let me know and I can do that. But so happy to be here, and I'll go ahead and pass the mic to whoever else is next.
All right, perfect. Thank you for that, Jose. And we'll let you have a few minutes towards the end of the session. You could share more about COVID-19. All right, great. I'm gonna go backwards. Let's hear from breakout room number 5.
I think that was mine. I'm not really sure. But yes, I think it is. I met great people in the breakout room, and I'm just glad to be here. Every time we do breakout sessions, it's an opportunity to network, especially now that we don't have in-person meetings. We kind of miss that. So thanks for creating that space. Something that we talked about is when we lose jobs and our lives are affected by, like a pandemic that we're experiencing, we tend to revert back to prioritizing basic needs. So that was very evident. But it's also very alarming because when people are, worry about housing and shelter, if that goes unaddressed in the long run, that can affect, future goals and plans and, things that people can accomplish just because now their focus has shifted. Giving the youth a voice through a survey like this one is very powerful. I think we all agree in that, giving them the opportunity to voice what they're experiencing through the pandemic is very, very important. And for them to know that there are organizations out there that are listening and are discussing the results of those surveys that can have potentially programmatic impact at a local level, that's very powerful. And it really shows that, they do have a voice and their voice is important. And, if they organize and, they put their minds together, they can have an impact in the community. So that's very, very empowering. Also, we discussed resource sharing is very important. There are a lot of different platforms out there, and then maybe trying to unify it or have similar information across the board to simplify the process can be helpful. And then also to share resource information, because there is a lack of understanding on how to navigate certain systems sometimes when you're experiencing things like, for example, homelessness. So utilizing youth that have a similar lived experience can be very, very powerful for that. And if anyone else from the group wants to add anything else, but we mentioned that also we appreciated the wording that was used in the questions, because as young people answering, just to see themselves as somebody who maybe have experienced homelessness because of the pandemic, just by answering that question, I think it helps them to understand that homelessness doesn't define who they are. It's just something that they're experiencing at the time. And I think it was very intentional to word the survey that way, and we all appreciated that.
Wow, thanks for that, Caesar. Yeah, great. All right, breakout room number 4.
If no one else goes, that may be ours. I'm sorry. I didn't recognize what number we were. So if I'm
No.
not number 4, you guys correct me, but I'm going to go ahead.
We were number
Number
4.
4.
You're right.
All right, cool. Thank you, JD. So in our breakout room, we had Carmen from Holly Mitchell's office, Boone, and also Jamie Hodge from Paving the Way, and myself. And so a lot of our conversations centered around the survey and some of the survey questions, and maybe even some of the things that were not asked. So it kind of led to, hopefully we can do some follow-up surveys. As I was explaining, this survey, we tried to mirror the prior surveys that were done in LA as best that we could, so we could have a point of comparison for the Antelope Valley. As you guys all know, we're pretty data strapped here in the AV, and so this is our first go at it to try to get some real concrete data for Antelope Valley. So that's why some questions may not have been asked, but the questions that were coming up in our group were really powerful and very valid. So I'm hoping we can do future surveys to address those questions. But the general feedback was that this survey was very illuminating as far as the services that are needed. The mental health aspect, is alarming. What our youth are experiencing in that realm. Also, workforce development is an area of concern for us all. And some of the questions were just kind of wondering, what type of jobs are the youth looking for? What are they interested in doing? And how can we help them, in the workforce development area? How can we help them more? Struggling with homelessness, that came up as well. And then another thing that jumped out was the fact that the $20, $20, you would think as a young person, 16 to 25 years old, they may just want to, kind of just spend it on something. But the fact that they needed it so much that they were using it to meet basic needs, that speaks volumes in and of itself as well. And that was pretty much the summary. If anyone else from the group wants to chime in, please do so. But that was pretty much what I had kind of noted.
Good job, Kim.
Okay.
Perfect.
All right. Thank you for allowing us to share.
Great. All right, thank you for that, Ms. Watson. All right, next, breakout room number 3.
I think that was us, but I'm not sure. But I'll try it anyway. I'm Lavelle Fleming with Antelope Valley Youth Build, and I had the honor to work with Christina from Valley Oasis. But basically what stood out to us, we talked about the number one, employment, where young people basically almost have to focus on trying to find a job in order to take care of their family. And so the way it impacted us at Youth Build, a lot of our students, they kind of backed up from doing their high school, working on towards their high school diploma in order to try to find a job. So some of them were able to balance both. Other ones, it was like, it was pretty difficult. And so, but I saw that, and it spoke to their heart, take care of their families, right? And so did do our best to work with them and like reduce classes, but, they had to kind of try to figure out and balance, like, do I pay this bill or do I get this assignment in? And so of course the bill's going to weigh out, right? And so that was, that just really opened our eyes. And then we also talked about because I came a little late, but about the stress, just dealing with COVID, the word COVID, I guess really, I never really paid attention to that part. You know, I knew they were stressed because of the situation, but just to, you know, that being a constant. So I was letting Christina know that with our students, the ones who are used to being in person and coming to our program, they did really, they suffered a lot because they had already knew what the experience was like. But then those who came into our program during the COVID, they were kind of okay because they're kind of like, okay, this is normal now, kind of. But so those are the two things that kind of stuff.
Great. Thank you for sharing that, Lavelle. All right, great insight. All right, next, breakout room number 2. And a few individuals had to drop out. So if no one's here from breakout 2, we could always go to breakout number 1.
Hi. I think I was in breakout 2.
2. All right, there you go.
Yeah. So Alicia Avalos, I'm with the Southern California Center for Nonprofit Management, and had various people. Had Laura, Maria, and Siboney in our breakout room. And we, initially just talked about, had some questions about the survey and how the survey would be used going forward. So we talked a little bit about, ensuring that youth and ensuring that that AV is represented, ensuring that the youth, young adults within AV are represented as well. And then also talked about identifying gaps to be able to advocate for resources in the future. But then also talked a little bit about being able to take the information and look at what current programs are made available in the AV, and how some of the findings can be used to look at program delivery now. Like, what are some things that we're doing now in the AV that can be addressed if there's certain gaps? Should we be doing more of something? Should we be doing less of something? So I think that was something that was really important. We also talked a little bit about the system part of it, the systems change, and how these things that are coming up in the survey, how they connect to larger systemic issues, and not just specifically in the AV, but in general throughout LA County and throughout, honestly, the United States. So started talking a little bit about that in, language, definition of homelessness, and how a lot of times certain definitions really impact people being able to access services. So really started to talk a little bit about, like, what definitions are we using, who determines those definitions, and how do you make sure that individuals with lived experience and lived expertise are involved in the program design? Because, in a lot of cases, folks that are making these decisions and these policy changes don't have that lived experience, don't have that expertise, but are yet making these decisions that impact so many people and create barriers to people being able to even access these basic resources that are a right, should not be looked at as something that you need to, jump through various hoops for. So we talked a little bit about that. We talked about the importance of language, and then just talked about, ensuring that how do we make sure that the information is being used going forward, and really just starting to think within what's currently happening, and then how this data is important to really being able to show the need in the area and being able to access additional resources beyond what's already here. So it was just a really good conversation, and really looked at, a lot of the misconceptions of young adults, and how the survey really brought that to light, on how young adults are thinking about their families. They're thinking about others. They're not just, self-centered, as unfortunately the media tries to portray them. So we just thought it was really insightful and really, really helpful. So thank you.
Thank you very much for that, Alicia. All right, great. And finally, breakout room number 1.
Hello, it's me, Tavier, and I was in the breakout room with Andrea, a new organization emerging, super exciting. Can't wait for her to share that. Christina and DJ, and Christina Smith from the city of Lancaster. And so I think we had a very lively discussion. So we talked about, like, how eye-opening it was, but we also talked about just recognizing that one of the major issues in making sure that this population gets the services that they need is a streamline, and the lack of accessibility and some of the barriers we already know exist. And so we went from re-identifying some of the challenges you guys represented to moving to a place of action and seeing how can we start bridging the gap. So since I am a director of a homeless shelter, as well as a TLP program, as well as a T-Access Center, I felt it was an obligation of for me to take this and move into action on what we can do to support, especially the individuals that are in the programs that I oversee. And so one of the discussions, we're definitely partnering with the amazing Paving the Way Foundation, as well as DMH and other mental health providers, to see if maybe we can, because I do have facilities that maybe we can invite people to have a rotating floating desk or rotating office space where they can come to the actual site, or, you know, depending on how the agency is working through our COVID restrictions or non-restrictions, but really just bring the services to the participants that are located within the facilities I operate. And so that's kind of how we spent our time. We went from a place of, wow, yeah, right, that's what's going on. And yeah, I agree, to, okay, what can we do? And so that's what we and we reestablished some new partnerships and partnering with Andrea and what she has to offer in her organization. And I think we're going to have some really great collaborations to at least do our part to minimize some of the challenges that were expressed in this presentation. And I just want to say, great job, Project Joy, as always. Amazing, 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 amazing. You know, I'm like Project Joy's unofficial cheerleader. So thank you so much, Team Project Joy. And thank you for my team. I appreciate you guys allowing us to go from like, let's discuss what's going on, to what can we do?
Wow.
And actually, that is a perfect, yes, thank you so much for sharing that. And Derek, I'm so sorry. I was going to say, we have run out of time. That's a perfect segue to our last slide, if possible, Jalissa, if you can pull that up. Because that's exactly where we're hoping this will go, to action. So yeah, the next steps, there it is. And also I put in the chat, I hope you guys saw it. I put it in before 12 because I know people had to head out. The link to our survey, it's 5 questions only. If you could please fill that out. That way we can ensure that we share the survey results with you. Yeah, we will share the full survey results. It's 58 pages. It's really great data, and I'm all for it. Like, we're all about the action too. You know, knowing about it is one thing. So now that our eyes are open and, you know, we're all on the same page with awareness, what can we do? And what can we do together? Even more so, collaboration is key. So those are kind of our 3 aspirations, that we can review our current and future programming, and intentionality around centering youth voice. This has already been said, so we're all on the same page already. I love the synergy. Number 2, continue AV-focused youth surveys as a collaborative, if possible, to ensure the widest reach and diversity of experiences. And number 3, strengthen our collaborative efforts here in the AV and leverage our expertise areas to best meet the changing needs of our Antelope Valley youth. So can we count you and your agency in? Please let us know on the survey. We so appreciate your time. We will not hold you any longer. We are out of time. But for today, we just want to say thank you, thank you, thank you. You are so appreciated. And together, you guys, we can truly change the world. We can change things. And does anyone, yay, thank you, Laura. Thank you again, Laura from Linsco, you and Robin, for all your wonderful work. Thank you for the agencies that partnered with us to make this survey happen so that we could get the 73 youth voices at the table and on the record. So thank you, Youth with a Purpose. Thank you, AV Youth Build. Thank you, Learn for Life, Desert Sands Charter High School. And thank you, Penny Lane Centers. We so appreciate your collaboration, and we are open to collaborate with all of you. Thank you. Have a great rest of your day.